Welcome back. When seeking mental health resources, convenience can play a large role in people choosing counseling that's right for you. I'm joined now by Carolyn Kirkwood of Kirkwood Therapy with details on why her practice may be a good fit. Welcome, Carolyn. Thanks so much for joining me.
Thank you for having me.
Of course. Let's talk about why you wanted to start and open your own practice.
Yeah, so I've been doing mental health work for about 10 years. And before being a mental health counselor, I was doing foster parenting. And when I was a foster parent, I saw a lot of families that just really were struggling to restructure the family, to restore the families and, keeping families together. And, I grew up in a house with 2 parents and I have 5 siblings. So I had a big family. So families are just very important to me. And as I saw that throughout the years, it was very important to me to open up my own practice to really focus on keeping families together.
Okay. What makes your practice different from others?
So my practice is unique because, for one, I do primarily telehealth. So telehealth is super convenient because you can do it right from home. So doing that, and then also I meet all of my clients exactly where they are. So I don't have a general way of doing therapy. I do a get-to-know-you session right at the very beginning with each client, and I structure the sessions for what's important to you, and that helps you meet your goals.
Right.
So I like to just kind of make sure each individual person get what they need from therapy.
That's great. I mean, when it comes to seeking therapy, committing to coming in once a week or every twice a week, however it may be, can be a barrier that stops people from getting the help that they need or could be using. But being able to have the benefit of doing your therapy where you're at, where you're comfortable in your space, you don't have to worry about commuting or anything, is a big help for people, right?
Yes, absolutely, absolutely.
Why is it so important for you to talk about mental health?
So mental health has been a very taboo topic for so long. And I am trying to work hard to change that narrative because we all struggle. We all have our things, and just as much as we promote physical health, I think it's also important that you focus on your mental health. And I think that we would be a better community as a whole if it wasn't so taboo and so embarrassing and everybody just embraced it, because we all have it. It's almost like it's embarrassing for one to admit that they see a therapist or a counselor or that they have a certain diagnoses. But it's like, that's ridiculous, because if I had, say, high blood pressure, I wouldn't be embarrassed to say, you know what, I'm not going to have that because I have high blood pressure.
Right.
And I want to try to create a space where, when it comes to your mental health, people can say that too. I'm not going to attend that because it's not healthy for my mental health, or whatever the situation is, and just be able to embrace that.
And it's also learning the skills that to implement, like you said, in your life. It's creating those boundaries in multiple ways, in multiple different areas, and getting those skills. How do you make your resources accessible to anyone?
So telehealth is huge, and we talked about that a little bit before, but telehealth is so easy because you can use it from your cell phone, your iPad, your tablet, whatever you have, your MacBook, and you can access your sessions from there. And I like it because a lot of barriers that people have, it eliminates, most of them.
Right.
So, like, for instance, some parents can't come because they don't have childcare, and some people can't come because they don't have transportation, or, it doesn't fit their schedule, and just all different types of things. But when you can do it right from the convenience of your home, it eliminates all of that. I have one parent who I see for postpartum depression, and I watched her baby grow up because the baby came to every single session. And I'm really good about that. Like, I'm very flexible. If you need to bring your child, no problem. The baby was about 3 weeks old when we first started. And I think the baby just turned 2 about a month or 2 ago. And some sessions she's sitting on the floor with him and he's playing with toys and she's talking to me. And way back from when he was baby, she was breastfeeding while she talked to me, But it was really convenient for her, and she was able to do it, and she's been able to maintain it with having the baby. And sometimes if she finds childcare, she does, and she tries. And if she doesn't, fine with me too. Yeah. I see people on their lunch break, and sometimes people are in their car. So that's really the convenience of it too. too, because sometimes when you work, most people work during business hours. Right? And so you can never get to your doctor's appointments or schedule therapy appointments. And after work, you got to pick the kids up. So you don't have the privacy to do it. And so I see people in the break room, and sometimes people sit on lunch break in their car, so that it just makes it really, really convenient and accessible for people.
Nice.
Yeah.
Let's talk about what insurances and payment plans you take.
Sure. So I am doing this relaunch this week for the practice because I'm taking a bunch of new insurances and trying to make it more accessible for people. So one of the biggest changes is that I now take Blue Cross Blue Shield, especially the Highmark plan, because that's one of the most common plans in Western New York that people have. So I accept that plan now. And I take Aetna and Cigna, New York Medicare, Quest Behavioral Health, and United Behavioral Health.
Nice.
And one of the biggest things is we are working on accepting Medicaid. So we're hoping that this spring we'll be able to announce that we're taking Medicaid as well. So that's one of my biggest things that's important to me, is being able to take those plans that affects the people that I like to serve, you know, in the Black community.
Alrighty.
So, yeah.
Well, thank you so much for
course.
coming in. Obviously, we're highlighting Black-owned businesses this month, and it's really great when we can also talk about places that are providing and pouring into our community
That's right.
as well. So thank you so much,
My
Carolyn.
pleasure.
If you would like to work with Carolyn and learn more about her resources, you can visit kirkwoodfamtherapy.com or call the number right there on your screen. Thanks again for coming in.
Of course, my pleasure.